I've been using the PhysioTouch for most patients that come through the door, mainly because we would normally do manual lymphatic drainage on most of the patients that come here. And really that's just an extension of that. We use the manual lymphatic drainage pathways to use the machine to lift the skin and take it in a different dimension to what our hands can do. We can go backwards and forwards, round and round, side to side and down, but what we can't ever do with our hands is give it that lift. Whereas the PhysioTouch just gives us that extra dimension, which is absolutely key to altering the pressures underneath the surface of the skin to allow all of the lymphatics that are superficial, which then go deep, to drain the excess fluid away. So it's been for most patients that come through the door. Well, they've been fantastic, which is why we've started using it with most patients. It doesn't cut the time that we spend with patients down, but what we're finding is when we measure things like limb volume as one of the measurable outcomes of our treatment, that we're getting a greater loss of fluid, which is the nature of the game really. So we're seeing, for patients who find it very difficult to tolerate bandaging, we've had results that are equivocal to bandage techniques just by using the PhysioTouch and compression stockings. So it opens up another avenue for patients who often have mixed etiologies and you would be cautious about using high levels of compression with. But the results are great, and the patients are saying, oh, are you going to use the machine on me again today? And these are people who've had my hands on them for some of them as long as 8 years. They're really keen to have the treatment with the PhysioTouch. Because of other treatment options that we offer in the clinic, we see not just lymphedema patients, but we've been able to use this machine on people who suffer with arthritis, in particular of the shoulder joint, they've had previous steroid injections with no benefit. 2 or 3 treatments on the PhysioTouch and we've got them back to work. We've had phenomenal results. Another area where I'm getting very excited about is the area of seroma and lymphocele, collection of fluid when the lymph nodes have been surgically dissected, removed or biopsied, can occasionally occur. And rather than the needle aspiration treatment, we've used it on a patient, very successful, which we reduced the seroma within 30 minutes of treatment, and it never reoccurred, even following a lengthy bike ride. So there's potential for future research is vast, but the immediate benefits that patients get with a multitude of conditions, all that have kind of a link to excess fluid, be it arthritis or seromas or injury or overuse of muscles, aching, sort of post-injury, have all benefited. We're on the line from the John O'Groats to Land's End route, and we get many cyclists staying in the village. We're about the halfway point, and we've had one or two of the cyclists come down for a quick treatment on their knees before they head off up to John O'Groats, and they've benefited immensely. It's meant they've been able to continue to do their charitable rides. So that's felt really good to be able to contribute to that too. Yeah, I think one of the other benefits that I think personally is worth mentioning is the ease of use. It's incredibly easy to use. It's a touch screen. The actual handheld device that goes on the patients is very simple. It fits, moulds nicely to the body that you're working on. But most importantly, it's incredibly easy to clean in between patient uses. It takes seconds, and that is just vital in a busy unit, and you know, can't be underestimated. So yeah, I find the ease of use and the ease of cleanliness afterwards a real benefit. Well, there's quite a few new things coming out on the market now, and I think it's always really key for any therapist that's considering using anything to to understand what the direct effect of what that piece of technology is going to be doing with your patient, but also to understand what the indirect effect is. And whilst with this piece of equipment, we're not putting anything into the body, we're using the body almost to heal itself. We're not using any electrical currents, we're not using any low-level lights or anything that's going to have an indirect effect that we're not sure about what that might be. Well, yes, there has actually. On a personal note, I've been a lymphedema specialist for over 20 years now, and when you're massaging and bandaging day in, day out, it kind of takes its toll on your hands. And more recently, I would say over the last 12 months, my hands have been incredibly painful first thing in the morning, getting things going. It's nothing to do with age, of course, it's wear and tear. But over the last 3 or 4 months, I've barely noticed any. Well, I've got no discomfort at all. So I feel as though I've almost got some sort of a few more years left in me, which is fantastic. So yeah, I've had a lot of personal benefit from a discomfort perspective. So yeah, I can still carry on using them, and hopefully more patients benefiting as a result from it.